Good evening, Berkeley community. I'm Mayor Jesse Edegin, and thank you for joining us for this virtual town hall meeting on the City of Berkeley's response to the COVID-19 pandemic. And just about 2 months ago, we had our last scheduled town hall meeting, and this was in recognition of the state's lifting of the blueprint for reopening and what we saw as declining case rates and increased vaccinations in the Berkeley community. We know over the past month, things have changed with the spread of the Delta variant. We are seeing an increase, not just in Berkeley, but throughout the region and the country, of infections, particularly among people that are unvaccinated. And so we felt it was important to come together again to update the Berkeley community about case rates and about the Delta variant and steps we're taking to slow the spread of the Delta variant. And as well to answer your questions directly, we received a number of questions from Berkeley residents. So very pleased to be joined today by our City of Berkeley Public Health Officer, Dr. Lisa Hernandez, and the Acting City Manager, Paul Budenhagen, who will be available to answer your questions. I just want to put today's town hall meeting in context. We know certainly that Bay Area health officers issued a new order to require the wearing of face coverings while indoors. And I'm sure Dr. Hernandez will update us about that new order and the need for it. But I just want to share some statistics, and if the host can enable me to share screen, I would appreciate it. I want to just run through, and the other participants, I want to run through where we are in terms of the increase in cases. So, okay. One second if I navigate technology. So I'm sure Dr. Hernandez will talk about this, but if you look here on the City of Berkeley's dashboard, since July, we are seeing an increase in case and positivity rates. The seven-day rolling case average per 100,000 as of today was 13.5 cases. That's a pretty significant increase from where we were just in June. In addition, the county data certainly is very similar, just seeing the increase in cases. I think it's also just important to look at this from a geographic perspective. And this is on the Alameda County dashboard. Where we're seeing the biggest increase in cases is in the campus area and in West Berkeley. But overall, while we do have, I think according to statistics from the City of Berkeley, roughly 70% of our city has been fully vaccinated and over 80% has had one dose. We still are seeing an increase in positive cases, and that is of great concern to the community. So, the threat of the Delta variant is real. And I think that requires that we not only take extraordinary measures to be able to slow the spread of COVID-19, particularly given the highly contagious nature of the Delta variant, but I think it's important to, debunk some of the misinformation that we're seeing out there. We're hearing a lot about breakthrough cases. Breakthrough cases account for roughly 1% of all the positive cases. And it's very likely that if you are vaccinated, you're very unlikely to contract COVID-19. The threat is those that are unvaccinated. And 99% of the hospitalizations and deaths that we're seeing are people that are unvaccinated. Vaccinations are the most effective tool for us to be able to control the Delta variant and to control the spread of COVID-19. And we strongly urge all those Berkeley residents who have not yet been vaccinated to get vaccinated immediately, because this is a very critical step that you can take to not only help us get past this pandemic, but to protect yourself, to protect your family, and to protect others. So, given the spread of the Delta variant, we felt it was important to provide an update to the Berkeley community. And, as needed, we will certainly have other town hall meetings as appropriate to update the community about latest developments in this global pandemic. So with that, I want to now turn the floor over to our City of Berkeley Health Officer, Dr. Hernandez. And first of all, just thank her for her incredible service to the Berkeley community over the past year, 18 months, that we've been battling with this unprecedented global health emergency. Dr. Hernandez, see if you can update us on where we're at in Berkeley in terms of the number of positive cases, and particularly what we're seeing with the Delta variant. If you can update us on any recent shelter-in-place orders or public health orders, and any other information you'd like to share with the Berkeley community about our response to COVID-19. So Dr. Hernandez, please take it away.
Thank you, Mr. Mayor, and good evening, City of Berkeley. Before I go into the numbers, I just want to kind of echo your comments. This is essentially a new virus that we're dealing with here in terms of its behavior, especially with how contagious it is and how it's impacting our community in that way. So that said, I want to go into the numbers, and as usual, I'll start with Alameda County numbers and then drill down into City of Berkeley, and then talk about our vaccination rates and for the city. So for Alameda County, there are 93,117 confirmed cases of COVID-19. That is not including City of Berkeley. And hospitalizations now are at 179 currently. Individuals are currently in the hospital. That may include City of Berkeley residents. And that's at nearly 2.5 times what the number was when I made this report to you back in mid-June. In terms of those in the intensive care unit, 49 individuals in the intensive care unit versus 17 back in mid-June. And deaths are now at 1,236 individuals have succumbed to COVID-19 in Alameda County. That's again, not including City of Berkeley numbers. Key measures that we still track, it's very similar to what you showed, Mr. Mayor, in terms of our case rate and our test positivity. For Alameda County, their case rate, which is the unadjusted case rate, meaning it's not adjusted for any of their equity testing or outreach, that unadjusted case rate is at 17.1 cases per 100,000 per day. And the test positivity is at 7.4%. Both of those two indicators are a 7-day average, 7-day lag. So this is what they were seeing a week ago today in Alameda County. So these numbers are higher right now in terms of their case rate and test positivity. Vaccination status for Alameda County, which does include City of Berkeley numbers, they have 71.8% of individuals 12 and older that are fully vaccinated, and 84.4% of individuals receiving 1 dose. When we look at City of Berkeley numbers, we've over 4,000 cases, 4,009 cases of COVID-19 that are confirmed and reported to us. We're averaging about 16 cases a day, which is a lot higher than the 1 case a day that we were seeing in June. Hospitalizations total, 136 individuals have been hospitalized in our jurisdiction with COVID-19. We are seeing more individuals hospitalized currently with COVID-19, and I'll talk a little bit more about that in a minute. In terms of deaths, we remain at 50. Our last reported death was in April, so we have not seen an increase in the deaths, fortunately. But as we know, deaths lag in terms of when we see peaks in cases, then we'll see a few weeks later a peak in hospitalizations, and then we may see increase in hospitalizations. We expect that number to be lower because of the effectiveness of vaccines, but we may see individuals that succumb to COVID, whether basically because they're unvaccinated or a small amount percentage of them that are vaccinated, but also had severe enough disease that they died. But right now, no change in our death count. Testing, we've seen an increased demand in testing. It's basically doubled in the last month, seeing about 666 tests per day performed and reported to us. That's an average again, but definitely doubled since the last few weeks. Our case rate and test positivity, we do this every day. This is not with a lag, but it is an average. Our case rate is 13.55 cases per 100,000 per day. And that was in comparison to less than 1 case per day per 100,000. Test positivity is at 3, actually 3.09 test positivity versus the less than 1% test positivity a month ago. So definitely seeing drastic changes in our numbers. Vaccine rates, we're seeing about 69% of Berkeley residents 12 years and older being fully vaccinated, and about 82% of Berkeley residents 12 years and older getting at least 1 dose. And I know a lot of people are wondering about that number. It looks like our vaccination rate has essentially plateaued, especially for fully vaccinated. We saw a little bit of bump in both of those numbers, more so with the first dose. So I imagine we're going to see more people fully vaccinated because of the news of the Delta variant. And you can see on our website that we're seeing a bit of an increase, but that overall number won't be appreciably greater because we are having under reporting because of individuals that are affiliated with UC Berkeley. So we count UC Berkeley in our population. So basically a vaccination rate is number of vaccinated over number in the population that is eligible. So the eligible population includes includes UC Berkeley students and faculty, and unfortunately, the vaccination number does not, because a good portion of the students are not on campus, and they are most likely using their place of residence, which is a home or where they are doing remote learning over the past year. So those are not City of Berkeley resident addresses. So that number looks a bit lower than we'd expect. We will most likely not capture that number in our overall vaccination rate that you see, but we know that Cal is requiring vaccination of their faculty, staff, and students, and we should be getting those numbers now. They're due to be reported by the end of this week by the students, and basic surveys from the campus indicate that students are currently over 90% vaccinated. So we know that that while those numbers are not reflected in our overall vaccination rate, that the student body is already pretty highly vaccinated. As you mentioned, Mr. Mayor, today I issued a health order along with 7 other health officers in the jurisdiction requiring indoor masking, regardless of vaccination status. I know there's questions about that. Well, what do I still have to wear a mask indoors if I'm vaccinated? Yes, you do. And this order requires individuals to wear those mask or face coverings in public settings, such as workplaces, restaurants, bars, clubs. There are some limited exemptions, and that's outlined in the order. But essentially, when you're indoors in public spaces, you must wear a face covering. I'm also recommending that all businesses make face coverings available to individuals when they enter their site. That is not a requirement, it's just a recommendation. And this order takes effect on 12:01 tomorrow morning. So early in the morning to tonight, Tuesday morning, the order becomes effective. And the reason for this order is to reduce community transmission. Basically concerned about the community transmission in Berkeley and across the Bay Area. And we're seeing that this Delta variant is more transmissible. We also have seen data released from the CDC that shows that even fully vaccinated individuals can in some cases spread Delta variant to others. So this indoor face covering will add an extra layer of protection for everyone. So that is the goal for that order. Want to still reiterate that vaccine is still very effective. It continues to strongly protect people from getting COVID, definitely protecting people from severe illness, hospitalization, and death. That is something I still want to urge individuals who haven't gotten vaccinated to get vaccinated. And what we see in our numbers is that essentially 96% of all cases are in unvaccinated individuals. And less than 1% of all hospitalizations are in individuals that are unvaccinated, and 100% of all the deaths are in individuals that did not receive the vaccine. That said, I just want to talk a little bit about the Delta variant. As you may have heard already, it's highly contagious. It's most likely to be more severe. We're seeing more and more data about that a characteristic of the virus. We're also seeing that it may be when individuals that are vaccinated happen to get COVID, and it is the Delta variant, they may be as contagious as an unvaccinated individual. Again, the reason for the masking order. So what does that mean? Basically, we'll see more individuals with COVID. We will see more what's called breakthrough, but it's really post-vaccination cases. And what we need to do is start doing the things that we know protect us, things that we should still be doing already anyway. Washing your hands as much as possible, covering your cough, staying home when you're sick, and wearing your face coverings when you're indoors. Other pieces of advice are especially for those individuals who are either immunocompromised or have family members that have not been able to get the vaccine due to age or health conditions, is to consider wearing your mask in all settings where you're in mixed groups that are outside of your household. The other is to consider going to different events and kind of calculating your risk, as we did recommend early on in the pandemic, in terms of not going outdoors and doing many being in many situations where there's mixing of individuals. The state this week or last week announced that they were going to require healthcare workers to show proof of vaccination or get tested weekly, and also having their state employees do the same. When it comes to healthcare workers in higher risk settings, the settings include acute healthcare, long-term care settings, high-risk congregate settings such as homeless shelters, and other healthcare settings. This policy takes place for congregate settings on August 9th and August 2nd, which is today, for state workers. So I will stop there because I know we have a lot of questions, Mr. Mayor, so I will hand it back to you.
Thank you so much, Dr. Hernandez. So now I'd like to turn the floor over to our acting city manager, Paul Butenhagen, who's also led our emergency operations center, and ask Mr. Butenhagen if you can provide us an update on city operations in response to COVID-19. Thank you for joining us.
Thank you, Mr. Mayor. Glad to be here. And thanks, as always, to you and Dr. Hernandez for your leadership throughout this entire pandemic. Much appreciated. The city services, when we closed down for a while, city services went remote. And actually, there was some good lessons learned and some efficiencies gained from that. But right now we are back open. Our city buildings are open for service. So whether you need to come into the permanent service center, or you need to get a birth certificate, or something from our vital stats, or public health and mental health clinics, buildings are open. As Dr. Hernandez just said, she issued the mask requirement. We in the city buildings have never stopped wearing the masks. So we've had a mask requirement for city staff indoors this entire time. So that doesn't really change anything for staff in the city. We continue to take precautions as appropriate, but city services are open and functioning.
Okay, thank you very much, Mr. Butenhagen. So we now want to turn to your questions. We received a number of questions around a number of issues, not just around the Delta variant, the recent masking guidance requirement actually at this point, but also questions around events, gatherings, city operations. So I want to turn the first set of questions over to the city manager's office. So the first question is, as long as there's a surge, can the city commit to holding city council policy committee meetings and commission meetings by Zoom? I know that, we're looking at, how to facilitate public meetings, after the state's executive order expires. And I know that we're sort of closely monitoring whether there's any additional legal guidance to the city of Berkeley and other local governments about how to conduct public meetings.
Yeah, that's exactly right. And we anticipate that at least through September, our meetings will be virtual, held on Zoom as they always have been throughout the pandemic. And then, as you say, Mr. Mayor, we're looking at what kind of a hybrid model could be put in place once the governor's executive order expires that would allow us to do some mix of in-person and virtual. So that's what we're looking at, both from like a technological perspective to try to make the meetings as as rich and vibrant and inclusive as possible, and also looking at legal issues surrounding that as well. So definitely a team of people working on that, and more to come.
So we are exploring a hybrid model. We're looking at the technological capabilities of the city to be able to do that, regardless of whether we're back to the old rules under the Brown Act. That is something we're actively exploring. And that was the second question that we have received. Moving to a question around paid sick time. For folks who test positive, can they be mandatorily sent home and get paid sick leave? If needed, can we go back to mandatory stay-at-home order for small time? We're dealing with a deadly variant, and I'm worried about those who are more at risk. I'm assuming they're referring specifically to city employees, but I guess the same would go for private employees as well.
Yeah, so for private employees, folks would have to consult with their HR department. I mean, there is state law that does offer paid sick time for certain categories of employers with, a certain number of people. I think it's 25 or more. So that would be something people should look at. We also do in the city have similar policies. So, I mean, I think if you're a city employee, you should contact HR if you have those questions. And if you're the same kind of goes for private. I don't want to wade too far into that.
Thank you. So next question was around whether there's consideration of new regulations for businesses that serve food indoors. And this, I guess, gets to another question that we have received regarding a quote vaccine mandate. Are we considering specifically requiring that restaurants, bars have to show proof of vaccination?
And I think maybe the health officer could weigh in on this. One thing we are seeing in many places, not just Berkeley, is some restaurants and bars mandating vaccine as a private employer. And private employers can decide to do what they want in terms of how they regulate vaccine or not for people that come in. Whether Dr. Hernandez would do that as a health officer, obviously I defer to her. But we are keeping a close eye on the case rates, as she said, and as you showed, and looking carefully and with some degree of worry about the Delta variant spreading, and thinking about how we can best protect the city.
And I'll just add or just emphasize what Mr. Budenhagen said, is that businesses are absolutely in their right to require vaccine for their employees or for their patrons. And I support that action on their behalf. At this point, my approach is to watch the data, look at what is the best next step. And what we know, especially with mask, it offers what's called source control, which means that it protects anyone who, or it prevents anyone who has COVID from spreading it. It reduces the likelihood of transmission. And as we've heard, while vaccine is key to controlling this pandemic or lowering the impact of this pandemic, we need to have multiple layers of protection, whether it's masking and vaccine. It's actually masking, vaccine, hand washing, staying home when you're sick. So all those recommendations, the things that fall into what's called non-pharmaceutical interventions, are even more important now with this vaccine. But yes, right now, I hope businesses consider all of those options, including mandating vaccine.
I'll just say, my own personal opinion is, one, I think that we should require our City and Berkeley employees, similar to what the federal government and state government have instituted, that we should require our City of Berkeley employees, particularly those in public facing roles, to be vaccinated or to submit to weekly testing. I think particularly those employees that are engaging with the public on a regular basis, given how transmissible this Delta variant is, I think it's a matter of public health and safety. I will also say, I just want to express another opinion, which is that I believe that private employers, particularly restaurants, bars, music and live performance venues, areas where people will be kind of clustering very close to each other for extended duration, that we should require that those businesses should require that people show proof of vaccination or a negative COVID-19 test. This is something that's been done in San Francisco and is increasingly happening throughout the state of California. And I call on our business community to work with the city to implement a voluntary proof of vaccination program, and to look forward to working with our business sector leaders to implement such a voluntary program in the absence of a specific mandate. Okay, our next question is on vaccine outreach and availability. Are there efforts to make shots available to the senior community, people with disabilities? If there are plans to keep transportation for the service to in-home, can we bring back sanitation masks in other locations, stores, hospitals, and restaurants? I think the general question is asking about our sort of vaccine outreach to seniors, persons with disabilities, and other sort of hard to reach populations. I know a lot of work is underway, and I'd like to ask the acting city manager to update the community about our vaccine outreach.
That's an important question, and I'm glad that this person asked it. The first thing I would do is point people who have the ability to check our website. We have a vaccine test. We have a page on our website for vaccination and for testing that shows all the places that, well, many of the places people can get vaccinated or tested. The city, we know that many of the people who want to get vaccinated have been vaccinated. So now what we're really focusing on is how do we bring the vaccine to people who aren't yet vaccinated? How do we answer questions of people who have some concerns about the vaccine in ways that they want to then get vaccinated? And then how do we provide that there? So, we have a team in our public health division, and Dr. Hernandez can speak to this more, that has been doing homebound vaccinations for seniors who can't leave. We've done quite a few of those, and we'll continue to do those. People can check the city's webpage if they have questions or want outreach in that way. We've also just recently created a contract with the Multicultural Institute to help get outreach out into monolingual Spanish-speaking communities and do more kind of real on-the-ground person-to-person outreach in ways that will help us get vaccine to communities that haven't had as much uptake as others. We are working on a couple of other contracts in a similar vein. So we will have a lot of community partnership. I also want to say that thank you, Mayor, for the work that you've done in bringing together the Vaccine Equity Group, which has leaders from across the city who are connected into populations that have fewer vaccines than other folks, and have worked collaboratively to strategize how we can bring vaccine to those folks. We currently are offering vaccines at the West Berkeley Service Center. So many seniors are familiar with that site since it's been the senior center, while North Berkeley Senior Center has been closed. We have vaccines over at Longfellow Middle School over on Derby, sorry. And again, I would say check that webpage, and then if you have questions, please do reach out to us, because we want to make sure that if you're interested in getting a vaccine, we help you get it.
Thank you so much, Mr. Budenhagen. The availability of vaccines is so critical to our ability to slow the spread of the Delta variant. And we do have 2 sites, as you noted, where people can access vaccines on a regular basis. Okay, I want to turn the next set of questions over to our City of Berkeley Health Officer. First question, looking at Alameda County's dashboard of total cases the previous 14 days, it looks like case rates are going higher than it was back in July of last year. We seem doomed to repeat COVID history. How do you expect this to proceed? Do we keep increasing to match or exceed the January 21 case rates, peak at lower rate, then go down? Or do we just stay up at 3,600 cases every 2 weeks indefinitely? Thank you for the work you do, your division, the public health staff everywhere have done.
That's a big question. But first, I'll say thank you for the thank you. I appreciate that. And I will share that, especially with the disease containment team who is working on cases and worksite exposures and what have you. They always appreciate the appreciation and the thanks from the community. So I'll say thank you for that. In terms of what do I think things are going to look like, first I'll say we're close, but we're not there yet to what we looked like a year ago. Very, very close. I do not think, I hope we do not get to the numbers that we've seen back in the winter surge, late December, January, February numbers. A lot of that has to do with the fact that we have more people that are vaccinated. So I don't think we will get to those numbers. We are seeing higher numbers, as you mentioned, but I think we won't exceed or meet those surge numbers, the case rates that we saw back in the beginning of this year. That said, we are still, it's a race against time with this variant and with other variants that may show up. This is the variant that we know, this is our enemy that we're fighting right now. But if there's a reservoir of people that are not vaccinated, that means there's a reservoir of individuals where the virus can live and mutate and become stronger and smarter. That's true. It's not science fiction. So that is why we need to get as many people as possible vaccinated. And as I mentioned, use the other pieces or strategies that are protective for ourselves, which include the masking. I hope that the masking indoors will reduce transmission while we continue to get more people vaccinated.
Thank you so much. Related question, what is the projection of the apex of the surge or the next one once schools open?
I think we'll see some increase in cases. We're learning more and more about the impact of this virus on children. Right now, we know that it's more contagious for everyone. We haven't seen as much data for children. And right now, what we're hoping and what we're expecting is that that the masking will be protective. We know that what we do know right now is the impact of not having kids in school. We know that it's been a devastating year and a half. And we know that that is due to the fact that kids haven't had in-person instruction. That is something that's certain. And what we know from the disease thus far is that it's less likely to be transmitted from child to child. So that is why everyone that can be vaccinated should be vaccinated, so we can have a protective cocoon around children. My daughter probably doesn't want to be cocooned by her mother, but she will be cocooned. But that is what needs to happen, is that everyone that can get vaccinated should be vaccinated, and that we wear masks. Those are the protective things that we know, and with that, we hope that that this is sufficient for protecting our children as they go back to school.
Thank you so much. Question around how you can contract the Delta variant. Is it true that you can get the Delta variant just by walking by someone, even if outside? How long is it safe to be in contact with an unmasked person?
So Delta variant is definitely more contagious. We know that it's at 60 to 70% more contagious, but what we do know is that vaccines are very protective. So you're not going to get, whether you're vaccinated or not, if you're just passing by someone on the street, you're not going to catch COVID virus. But what we know is that if you are masked and vaccinated, you're much more protected.
Thank you very much. Another question. There's several questions around people asking if they should change their sort of travel plans or meeting plans. This question, my family's planned a trip to Europe in late August. Should we cancel this trip? Has the Delta variant spread as rapidly there?
Delta variant is all over. It's most likely the predominant virus globally. I think that whether it was Delta or another variant, whenever you travel, you are putting yourself at risk for exposure to COVID virus because you're mixing with individuals that you normally don't mix with. You're traveling most likely into areas that are a bit more congested. And those are all risk. So I would consider those pieces of information, as well as what is specific for your family situation in terms of how many people, is everyone vaccinated? What are people's health conditions, if any, that would put them, make them more vulnerable to getting severe disease or to getting COVID if they're not able to be vaccinated? So I would say those are the pieces that I would look at and see what the restrictions are at the places that you're going to travel. There may be restrictions already set in place for testing and for vaccination and wherever you're traveling. Unfortunately, I haven't looked at traveling to Europe. I've actually never been, but definitely something that I would say is going to be individual per family.
A question, I think you did address this in your opening remarks. Should we still be washing our hands frequently? What types of masks should we wear if we are fully vaccinated?
Please, please, please wash your hands. And I would say that whether we were dealing with the COVID pandemic or not. But yes, please wash your hands. That's always a good way to reduce your chance of getting any disease. We are seeing colds coming back in full force as well. So that's also going to protect you from other viruses and bacteria that are circulating. In terms of what's the best mask to use, still the same recommendations as before. At least a double layered cloth mask is what we recommend, that is fitted properly, especially for making sure that breath does not escape from the sides and over your nose. I can tell whether my mask is fit well because of my glasses. I get my glasses fogging. For other individuals that don't wear glasses, you want to ensure that there's no escape of air in those areas. Also, no mask with the vents. That is also a risk in terms of expelling your breath. So that's another mask that we do not recommend for people to wear. Again, also gaiters and bandanas, really not the best either. You want some masks that fit specifically over your nose and mouth and that have that tight fit.
Okay, thank you very much. Question from an employer. My staff has returned back to work in person. All are fully vaccinated and we keep a good distance apart and are in an office environment that does not see the public. Should we go back to working from home? Is there elevated risk even if all of us are vaccinated?
So that workplace is subject to the health order that is effective this tomorrow morning. So you should be wearing masks, even if you're not interfacing with the public. And it's going to be an individual decision by the business owner whether you want to continue to have hybrid or remote working options. I'm happy that you're using the distancing, that you're able to use the distancing. That's also going to be another layer of protection.
Okay, thank you very much. Another question, should we avoid socializing with people who have kids under 12, especially once school starts?
So I'm not sure what the underlying question is. If you feel like you're going to be more at risk because of the children potentially being infected because they're going back to school or because they're not vaccinated. How I think of it is that I don't want to expose individuals that can't get vaccinated. So I would try to reduce my exposures to people that are not vaccinated. If I can, if I do socialize with individuals that can't be vaccinated outside of my household, I would do it outside. I would absolutely do it masked. And I would, probably not do it as often as I would like to because of the behavior of this Delta variant. I think schools are going to be a safe place for students, especially because of not only the masking that is required, but all the other requirements in terms of surveillance of the students in terms of their symptoms, all the other protections that they've had to put in place to have a safer school setting. So we have seen in some instances where once school ends, people have seen increase in cases in some jurisdictions, suggesting that schools are safer than not being in school. So I would say that it's going to be a stressful time for school to start. I know it's always a stressful time for the first day of school, at least in my family, but it's also a time where we know that kids are going to go to settings where there's been lots of thought and in terms of having a safer school setting for students to come back to school.
Thank you. A couple of questions around gatherings. One question is, this resident would appreciate any regulations or recommendations regarding gatherings of 50 people without social distancing abilities, i.e. a performance event. And then I'll tack on another question, which is, there's a neighborhood fire safety group that is planning on having an outdoor event with possibly 150 to 200 neighbors attending. And given the Delta variant, should they postpone the event, hold it online? They were hoping for some specific guidance from you, Dr. Hernandez.
Sure. So I'll take the fire event first. That's my understanding. It's an outdoor event. And as we know, there are certain things that still remain no matter what variant we're looking at. Outdoors is safer than indoors. If you're physically distanced, that is going to be safer. It's not a requirement, but these are sort of the things that we know that are true. Outdoor safer, distancing is safer because we know that when you are within 6 feet for 15 minutes or more, there's chances for getting if you're exposed to someone with COVID, you're more likely to get it, especially if you're not masked. So another thing would be consider wearing masks, especially if you or someone in your household is not vaccinated or has conditions that are high risk for getting complications to COVID. So that's what I would say. It's going to be an individual decision. It's going to be an individual business or group's decision whether to cancel. I believe that we can still have group events, especially if people are practicing COVID safe activity, taking COVID safe actions such as being vaccinated, washing your hands, staying home if you're sick. Those actions really will make any event safer. And Mr. Mayor, if you could describe the first request again.
The first question was whether there's any specific guidance on gatherings of 50 people where you cannot socially distance.
There are no specific guidance or orders that are currently in effect. I would use the same pieces of same actions and recommendations in terms of trying to minimize if you can socially distance. Sound like it's not the greatest and in terms of that, but I would say that having people mask is required, and having people vaccinated is also something that is definitely going to increase protections. The other piece that I haven't mentioned, especially for indoors, is good circulation. So good ventilation in the indoor work event space would be also something that would be helpful.
Thank you. Question around hosting a dinner party or small gathering in our homes indoors with other vaccinated friends. Are we still required to wear face coverings?
It's not a requirement. It's definitely a recommendation, especially if any of the households, or if you are a household with unvaccinated individuals. It's not a requirement. That's a private event within your household, but it is definitely a recommendation, especially for those members of the party that may have individuals in their home that are not able to get vaccinated or have high risk for COVID.
Thank you. I'm a business owner, would like to require people to get vaccinated. Everyone in my business is vaccinated. Do we need to follow the mask mandate? Yes, you do, regardless of whether everyone in your business is vaccinated. It's about reducing the transmission of COVID and the Delta variant. And while vaccinations are the most effective tool to reducing the spread of COVID-19, for those that aren't vaccinated, and we don't know definitively who or who isn't, unless the business is employing some sort of process of verifying vaccination status in order for people to enter and to patronize the business. And we also know that people that are vaccinated could potentially spread COVID-19 to others. That face coverings are an essential tool to be able to reduce transmission. Did I say that right, Dr. Hernandez? Okay.
Thank you.
Question around the tiered system with an increase in cases. Why hasn't the state instituted a color tier system with limits on things like indoor dining? I know 2 fully vaccinated people in Berkeley who got COVID-19 in the last couple of weeks. Very sorry to hear that. Should masks be required in all indoor settings and not just a suggestion? Well, to your latter question, yes, and that is the subject of the recent health order requiring wearing of masks or face coverings within indoors. With respect to the color tier system, I really think that's a question for the state of California. I guess I'll turn over to you, Dr. Hernandez. I would imagine, we're monitoring the situation very carefully and about whether, what additional requirements or restrictions need to be put in place to help deal with a surge in cases.
Correct. That is something that we all are looking at, all public health officials, whether it's city, county, state, nationally. We're looking at the rises in cases and what we can do to avoid higher numbers. I will say that the best tools we are in front of us already, which include getting everyone vaccinated as soon as possible. So that's one thing that we all continue to focus on. And then also looking at the recommendation, and for us in Berkeley and 7 other jurisdictions, the requirement in the Bay Area, the requirement to mask indoors. So those are the things that we know will help reduce the ever increasing case rates that we're seeing. And what we do know is that the majority of the individuals that are especially getting hospitalized and in other in jurisdictions that are dying are unvaccinated. So we know that looking at the severe impact of COVID, we know that that's majority of individuals that are suffering the severest complications of COVID are unvaccinated, and that's what we're focusing on at this point.
Question, I've contracted COVID-19 earlier this year and recovered. Should I still get vaccinated?
Yes, please do.
Yes. Okay. Couple questions. These are really legal questions, but we will certainly do our best to answer them. Is it possible to hold an event and require, I'm assuming this is a private business, require that people show proof of vaccination prior to entry? If yes, then can people go en masse? To your latter question, no, if it's indoors. To the former question, I believe legally that any private business or employer can require proof of vaccination.
Yes.
And a similar question, as an employer, do I have a right, I'm assuming private employer, do I have a right to require all of my staff to be vaccinated?
Yes.
Yes.
That is in the Cal OSHA language. I don't have it up, but you can go onto the Cal OSHA website and it shows, I think it's in there, frequently asked questions. That's where I would look first. It's easier to read than some of the language in Cal OSHA, but it is definitely referenced on their website.
So to reiterate, a business can require proof of vaccination to enter the business and patronize the business. You are still required, if people are doing business indoors, people must wear a face covering per the new order that's been issued. An employer does have a right to require staff to be vaccinated. And I just want to reiterate, there's a lot of discussion happening right now with our business community about whether to implement a voluntary program to require that businesses like bars, restaurants, live performance venues require proof of vaccination. This is something that some businesses in San Francisco have implemented. I want to just once again reiterate my strong position that I think such a voluntary program should be instituted, absent any sort of guidance that a mandate by the city can be issued. Fundamentally, the challenge that we face is people that are unvaccinated, who are, contracting COVID-19. People are becoming very sick. People are becoming hospitalized. And I think we need to create a set of incentives or disincentives for people that are unvaccinated to get vaccinated. While we need to make vaccines more available, and we need to recognize some of the cultural cultural barriers for people to get vaccinated. We also need to make it clear that, not being vaccinated puts your community at risk, and it prevents us from being able to manage the spread of this pandemic, and that you have a broader public health and moral responsibility to get vaccinated in order to help our community get through this pandemic. That leads me to our last question, Dr. Hernandez. Are we going to try to force people to get COVID vaccines? Please don't. The vaccine can be, quote, deadly to people with compromised immune systems. Many people have died from the vaccine. Requiring vaccines violates California's right to privacy, et cetera. I just want to say that's a false statement. Nobody has died from getting the vaccine, but we know that 4.2 million people have died from contracting COVID-19 worldwide, and that number increases. So I don't know if Dr. has anything else you'd like to add.
Yeah, and I would add that we've administered throughout the United States and globally over 340 million doses of vaccine, and have seen very little effects or side effects or complications from getting the vaccine. But as you mentioned, the number of individuals who have died from COVID is immeasurable. I mean, there's the risk of getting a vaccine is so small compared to the risk of having COVID and getting complications.
So, I just want to debunk the misinformation that's out there. Vaccines are safe. Vaccines are effective. Vaccines are critical to protect yourself. 99% of the people that we're seeing in hospitals and ICUs are people that are unvaccinated. Yes, we hear about breakthrough cases. It's a very, very small percentage. It's roughly 1%, in some cases less than 1%, in some jurisdictions of hospitalizations or cases are due to breakthrough cases. So while a lot of attention's been focused on breakthrough cases, the focus should really be on the unvaccinated, because those are the people that are at greatest risk, and those are the people that frankly are at the greatest risk of contracting and transmitting COVID-19, putting others at risk. So vaccines are safe. Just because there's less than 1% of the total United States vaccinated population as a breakthrough case, doesn't mean that vaccines aren't effective. Over 99% of people have not had a breakthrough case. Where we need to focus our energy and attention are on the unvaccinated. So once again, vaccines are safe, vaccines are effective, and are absolutely critical to protecting yourself, your family, your community, and for our community and our country and our world to move out of this deadly pandemic into a period of recovery. So thank you, Dr. Hernandez, for answering those questions. I want to address a question around the eviction moratorium. We know that over the weekend, the federal eviction moratorium did expire. And I just want to reiterate that our Berkeley eviction moratorium is still in effect. And this question is, will Berkeley be supporting a continued moratorium on tenant evictions as we're dealing with the surge in cases due to the Delta variant? Once again, locally, the eviction moratorium is tied to our local state of emergency. We have no intent on ending the local state of emergency anytime soon, particularly given the increase in cases that we've talked about today. So those protections remain, even though the state's eviction moratorium may end in September 30th. If you live in the city of Berkeley, you cannot be evicted for non-payment of rent during this pandemic. And we feel it's essential to continue to provide these critical protections to our residents, many of whom are housing insecure due to loss of income, loss of jobs. We know that people becoming homeless, not having shelter or housing, puts them at greater risk of contracting COVID-19 and spreading COVID-19. And this is an essential public health measure, not just a housing measure, but a public health measure. Question around back rent. How do people that have accumulated back rent receive funds to get their rent payments caught up? I understand the state has provided resources for this purpose. Yes, if you go to covid19.ca.gov, you can access information on the state's new rental assistance program. The governor in his recent budget allocated funding to provide 100% rent relief for tenants or landlords who apply for that funding. In addition, the city of Berkeley, actually starting immediately after the emergency was established in March, the city of Berkeley had expanded our housing retention program to be able to provide emergency rental assistance for tenants who are unable to pay their rent due to loss of income, economic impacts due to COVID-19. I want to just once again provide information about how people can access those resources. First of all, if you have specific questions around your housing status, we urge you to contact the Rent Board at 510-981-7368. And if you would like to apply for funding through the City of Berkeley's Housing Retention Program, please contact the Eviction Defense Center at 510-452-4541 and indicate that you would like to apply the retention program. Once again, that number is 510-452-4541 and ask for assistance with applying for the housing retention program. Okay, I believe that answers all the questions that we received today. In closing, I just want to reiterate that we will continue to convene these town hall meetings as appropriate. The spread of the Delta variant and the increase in cases that we've seen over the past month, I think really prompted the need to reconvene and to update the community about what is happening and the steps that we are taking. I know that our public health officer and staff are monitoring this on a daily basis, and we will continue to respond and escalate our response as needed to protect our community's health and safety. But I just want to reiterate, while City of Berkeley's taken a lot of steps, through public health measures and increasing access to vaccines, you individually can take steps to help us combat Delta variant by wearing a face covering when you're indoors, by practicing physical distancing, and many of the sort of hygiene, sanitation requirements, washing hands, et cetera. And then moreover, if you have not been vaccinated, to get vaccinated as soon as possible, because you are at greatest risk with the spread of this highly transmissible Delta variant. And the more people we can get vaccinated, the more we can control the spread of COVID-19. The fact that we have 80% of our city who's already received one dose and 70% that have been vaccinated, and those numbers are more with the UC Berkeley population, is a huge step forward, but we need to do everything we can to close the gap and to make sure that as many people in Berkeley are vaccinated as possible. This is the individual collective action that we can take to combat the Delta variant, to fight COVID-19, and to move our community out of this deadly pandemic. So thank you all for tuning in today. I want to give our panel an opportunity to offer closing comments before we conclude. So Dr. would like to add or share with the Berkeley community tonight.
Thank you, Mr. Mayor. I want to thank you for having us here today to do a town hall. This is an important time for everyone to hear the status of our city and what we're seeing in terms of the transmission, and more importantly, to have their questions answered. This is a service that I am in your debt for providing to the community. I think it's important. It's going to make us and keep us a safer community. I also want to thank everyone here in the city for doing a great job of protecting themselves and each other. I think that still has not changed over the pandemic, that individuals are good at being good neighbors, and I appreciate that. Thank you, Mr. Mayor, and I'll hand it back to you.
Thank you so much. I'll ask our acting city manager, any closing comments for the Berkeley community tonight?
Well, I'd like to thank you again, Mr. Mayor, for hosting this town hall. I want to thank Dr. Hernandez for all of your informative and thoughtful and supportive public health information. And I'll say also thank you to the community, as she did, for your support and you're working hard to stay masked and get vaccinated. There may be questions as we move forward from today's health officer order around masking, or there may be violations that you see. I would encourage you just to call 311. We are putting together a team of folks here who can respond. So if you see people who are not wearing masks in stores or whatever, you feel free to contact 311, and then we'll address those through the city. Otherwise, we remain open for business as a city and look forward to serving you. Thank you, Mr. Mayor.
Thank you very much. So thank you all for tuning in today, for your very thoughtful questions. Please know that, while we have made a lot of progress as a community, that the surge in cases we're seeing nationally and even in Alameda County with this highly contagious Delta variant really puts at risk all the progress that we made to date and puts our community at risk. And so please take the individual actions that you can through complying with our new masking requirements, practicing physical distancing, and also if you have not been vaccinated, get vaccinated immediately. Go to covid19.ca or go cityofberkeley.info/COVID-19. The state's website is covid19.ca.gov. You can either sign up through CDPH or you can sign up through the City of Berkeley to get vaccinated. Please get vaccinated today. Do your part, help keep your community safe. So thank you so much for joining us tonight and have a good day.